Good afternoon, everyone. I'm Dr. Manju Gubhaju, MDS Orthodontics from Nepal. You can see this is my country, Nepal. It's a small country in between China and India. Though it's very small, it is gifted with natural beauty. You can see in a photo of my country. And you can see Lord Buddha, he was born in Nepal. And the world's highest mountain, Mount Everest, is situated in Nepal. You must be surprised that 8th tallest mountain among 10 is in Nepal.
Everest is in Nepal?
Yes.
Not in China?
No. And this is my flag of my country. You can see one of the most unique flags. Now going to the presentation. Okay. The topic of my presentation is correlation between the anterior-posterior relationship of dental arch and skeletal jaw base in Chinese population. Okay. In this, I'll be dealing with introduction, method and material, statistical analysis, results, conclusion, and recommendation. Okay. In 1899, Sir Edward Angle, he classified malocclusal on the basis of occlusal relationship of first molar called Angle's classification. This Angle's classification is most widely used and accepted in the world. But you can see Angle's classification, it has many drawbacks, and one of them is it does not differentiate between dental and skeletal malocclusion. Many studies has revealed that dental arch is largely affected by the underlying skeletal jaw base, and usually dental alveolar compensation occurs in order to reduce the severity of the skeletal jaw base relationship. But we usually assume that malocclusal exhibited by the dental arch is the reflection of underlying skeletal jaw base malocclusion. It is always important to have sound and in-depth knowledge of dental arch and occlusal along with the underlying skeletal jaw-base relationship to, number one, for the correct diagnosis and treatment planning, and to decide in a surgical case whether to undergo orthodontic surgery or only dental camouflage is necessary. And any study that try to correlate the dental arch and skeletal jaw-base should be undertaken in a population. There has always been controversy whether the anterior-posterior dental arch relationship coincides with the underlying skeletal jaw-base relationship. So the aim of the study was to correlate the association between the anterior-posterior dental arch and skeletal jaw relationship in Wuhan population, and also to compare different measurement means associated with determining the anterior-posterior dental arch and skeletal jaw-base relationship. So moving to the method and material, the sample patients were collected from the Department of Orthodontics, Wuhan Union Hospital, China. And out of number of patients being treated, 472 sample patients, males 174 and female 298 of age group 14 to 40 were selected. And the criteria for the selection of the sample patient was all the patients should have permanent teeth erupted till the first molar in all 4 quadrants, no congenitally missing tooth should be present or any supernumerary teeth, no obvious jaw pathology, syndrome, or any gross asymmetry should be present. Another criteria are there shouldn't be no any previous surgical procedure or any functional appliance should be have been used before. Pre-treatment radiograph should have adequate diagnostic quality, and study model should have no broken teeth and should be neatly trimmed. So now for the study to be carried out, intraoral photographs and dental cast, Intraoral pretreatment lateral cephalometric radiograph and panoramic radiograph were collected. Now, intraoral photograph and dental cast were used to determine the anterior postural dental arch relationship on the basis of angles classification. And the sample patients were distributed into 3 different groups with 3 different molar classes, class 1, class 2, class 3 molar classes. Now the lateral cephalometric radiograph were traced for A and B angles, width appraisal, and beta angle. This is the tracing for A and B angle, for the width appraisal, and the beta angle. The beta angle must be new for the most of you. So to determine beta angle, first of all, point A, point B, and point C are located. And a straight line is drawn from point C to point B. Point C is the angle center of condyle. Another line is drawn from point A to point B. Now a perpendicular line is drawn from point A to CB line. Now the angle formed by this perpendicular line from point A to CB and the AB line, this is the beta angle. And the beta angle determines the skeletal discrepancy between the maxilla and mandible in the sagittal plane. These are the cephalometric reference value for the classification of anteroposterior jaw-base relationship. Now, depending upon this, depending upon the reference value, the patient will divide the patient were distributed into 3 different groups. This is skeletal class 1, class 2, and class 3. Now we move to the result. Before that, the statistical analysis. These were the statistical analysis being used. And statistic was done by SPSS version 20. And the significant label was set less than 0.05. Now to the result. The sample patient, 472 sample patient, were distributed on the molar classification was class 1 was 54%, class 1 were 54%, class 2 25%, and class 3 was 21%. Now by A and B angle, the class 1 was 71%, class 2 was 16%, class 3 13%. This is the comparison with the study done by Chow et al. In 2008. Now this is the result when the analysis was done by width appraisal. Class 1 was 63%, class 2 was 17%, class 3 20%. And by the width appraisal, class 1 was 74%, class 2 was 11%, and class 3 15%. We'll go to the conclusion at the last. This is the comparison between the distribution of patients with various molar classes and skeletal classes. Now this is a chart showing the distribution of the patient with various molar classes and skeletal classes assessed by A and B angle, width appraisal, and beta angle on the basis of molar classes. In this we can see the molar class 1, 256 patients when assessed by A and B angle had 200 patients class 1, 32 were class 2, and 24 were class 3. Similarly, with the width appraisal, it was 174 class 1, 28 class 2, and 54 class 3. And by beta angle, you can see 206 with class 1, 24 class 2, and 26 class 3. And the most surprising result we got is molar class 2 patient had 4 patient class 3 when assessed by A and B angle. And you can see by width appraisal, class 2 patient, molar class 2 patient was skeletally class 3. And by the beta angle, it was 6 patient were class 3. By the molar relationship, it was class 2. Similarly, in class 3 patient, we can see By A and B angle, it was 12 patients had class 2 skeletal class, and by which it was 6 patients, and by beta angle, it was 4 patients. This is the same thing. The chart is elaborated in the bar diagram. And among the measurement means used to assess the relationship, we can see beta angle shows the highest percentage of correlation or agreement between the anterior-posterior relationship of dental arch and skeletal jaw base. Now the conclusion. The study concludes that Angle's classification of dental malocclusal does not reflect the true anterior-posterior skeletal jaw-base relationship. And the result shows that only around 1/2 of the anterior-posterior dental arch relationship coincides with the underlying skeletal jaw-base relationship. And this, you can see the percentage of concurrence or percentage of correlation. Beta angle shows the highest percentage of correlation, followed by A and B angle and width appraisals. So without disregarding previously established method, we should always consider updating and applying research advantage for the better diagnosis and treatment planning. Because most of you haven't heard about beta angle, but beta angle shows the highest percentage of correlation. So I would like to recommend this kind of studies to be done in the multi-center, because it was done in single-center study and should be carried out. This was carried out in Chinese population. I would recommend to do the study in the whole world and also compare other different measurement means. Thank you so much. This is my family, my husband.